Hello guys, this is the second video when we were yesterday talking about the pain assessment. So this is a continuation, a video of what we learned in the last video about the pain assessment. So let me just go into the slideshow and we will learn about the rest of the mnemonics that we learned yesterday. So we are actually learning about the mnemonics called as old carts and ice. OLDCARTS and ICE, ice. Now this mnemonic can be easily remembered, and it is an easy tool to remember when we are assessing the patient's pain. In the last video, we did about the OLD, which stands for onset, location, and duration. In this video, we are going to learn about the CARTS, cards. So where C stands for character, A stands for aggravating factors, R stands for relieving factors, T stands for treatments, and S stands for severity of pain. Okay, so today we are going to consider this 5 pointers when we do the assessment of the pain of patient. So C, the character of pain. The question that we should put before the client or the patient is, in what words would you describe your pain, or what words would you use to describe the pain that you are feeling? So he might say a few certain things, but we can look into the 3 classification of pain that we would have. Okay, I think it is clear now. The somatic pain. Somatic pain presents like a bone pain. Okay, and there are 3 characteristics of it. It is well localized, it is constant, and it is dull, aching, and gnawing pain. That is the characteristic of a somatic pain. All right. The second type of pain which may be considered is the visceral pain. For example, the abdominal pain that we have. Now, in this case, the pain would be poorly localized. It can be referred, and it is described as cramping, stretching, or fullness. This is the second type of pain or the characteristic of pain that the client or the patient can explain in his own words. The next pain is the neuropathic pain, which is most commonly seen in our clinical practice. And the example would be a peripheral neuropathy. And this is characterized by a burning, numb, or radiating or shock-like kind of pain, and that is a characteristic of peripheral neuropathy or a neuropathic kind of a pain. So that's how we can classify or characterize the pain that a patient would be referring to us when we ask him certain questions, asking him to describe his pain, and this is the way in which he can or he or she can describe the pain. Now, that is what we can get from the patient or understand from the patient about the character of pain. The A stands for aggravating factors. Aggravating factors, or we can ask in simpler terms, what activities or what things can increase the pain. That also we have certain things. It can be a movement like walking would be a movement that would increase the pain. The patient could complain that I walk for 10 minutes or 15 minutes, and then I started having the pain, or the pain that I have is increased by my walking for 15 minutes or 10 minutes or such thing like that. Any position could increase the pain, like standing for a long time. He would say, if I stand for 15 minutes, the pain increases, or sitting for long, or lying down. These are the positions which could aggravate the pain, and these are the things that we should ask the patient. And any other miscellaneous activities would be like coughing, sneezing, urinating, moving bowels. All this could also lead to an increase in the pain and can be classified under aggravating factors. So these are the aggravating factors that we should mention when we are assessing the pain or the condition that the patient is presenting with. So these are the aggravating factors which we should mention in our assessment for pain. The R stands for relieving factors. Relieving factor, or what things reduces the pain or relieves the pain. Again, there are certain pointers that we should always keep in mind. Does painkillers or analgesics decrease the pain? Does any position or splinting or modifying activity decrease the pain? Or other non-pharmacological modalities, like without medicine, any other modalities that the patient might be using? He might be using ice, heat, massage, or maybe attending a physiotherapy session like TENS, or a psychologist or a therapist for cognitive behavioral strategies. These are the things which can relieve pain or reduce pain. And these are the things that we should be asking the patient. What are the things that relieve the pain is what we should mention in relieving factors. Now, the next is the treatment. Again, in treatment, if he had received any previous treatment for this particular condition or pain, that we should ask him what treatment he underwent, what was the response when he underwent the treatment, how long and what was the dosage that was prescribed to him for this particular treatment, and why did he discontinue, or why was that treatment stopped or discontinued, is what we should understand from the history that we get from the patient. That entails the treatment part of it. Okay, next we go on to severity of pain, in which we have the following pointers under it. It describes the severity of pain. And we have very common tool that we usually use in our clinical practice, and that is the VAS scale, which is a numeric rating scale from 0 to 10. And we ask the patient to grade the scale according to the severity of the pain that they are experiencing. So they will grade it as 0, where 0 means no pain, and 10, which means the severe pain that they have ever experienced. So it is 0 to 10 pain that they can grade according to the severity of pain that they are experiencing. The next scale is the Wong-Baker Faces Pain Scale, in which the pain is graded according to the facial expressions along with the numeric rating scale. So there are different face expressions which are mentioned on the scale along with the numeric system that is mentioned in connection with the grading the scale which the patient is experiencing. The third is the FLAC pain scale. The FLAC pain scale is the one that we can use with young patients who are not able to communicate well concerning their particular condition, or the patient who are adults and but still not able to communicate. In those cases, we can use this FLAC scale, where FLACC stands for face, leg, activity, cry, consolability. This scale also has a particular grading system. There are 3 scores, 0, 1, 2, for each division that is given, the face, leg, activity, cry, and consolability. And for each scale or each commodity, there is 3 grades which have been given, 0, 1, and 2. So the total score will be 10, and out of 10, the score will come as, if it is 0, it says relaxed and comfortable. If it is 1 to 3, it says mild discomfort. If it is 4 to 6, it interprets moderate pain. And if it's 7 to 10, it describes severe discomfort and pain. So this is how we grade the FLAC pain scale when we are doing the pain assessment of the patient. And today's video is in connection with these 4 or 5 things that we have learned today. So today we have learned about the character of pain, the aggravating factors, the relieving factors, the treatments, and the severity of the pain. Hope you have found this video encouraging and also informative. And stay tuned with my channel when you like and subscribe it, and also share it so that you may be able to learn more about the pain assessment as we continue to learn the rest of the part of the old cards and ICE mnemonic in our pain assessment. Thank you and have a good day.